I think it's a much more widely accepted thing for women to get aesthetics than it is for men.
Why?
I think there's just a big taboo around the whole subject anyway, and I think there's even more of a stigma when it comes to men. Vanity is a massive part in what we do, isn't it, nowadays? Like your appearance and how you express yourself is very much based on how we look, how we dress, etc. So hair loss and young men, because it happens to anybody, doesn't it? But young men who are losing their hair, this is something they might be able to consider and see if it helps. But the way to break through that taboo is like stuff like this.
Talking.
Yeah, talking.
I thought it would be a good idea if we essentially recorded a conversation I wanted to have with you last week. So for a little bit of background, my name's Liam. I am a student nurse and I've just joined a partnership with this man right here, who is Tom.
Hello.
What do you do?
So I'm Tom. I'm a nurse prescriber, and I've been working in this field for 16 years. Liam's been student nursing for the last 3, really.
And there's been a lot of eye-openers during that time. I guess most of my questions come towards you, whilst rather they probably should be on placement with my mentors, but they're not often around. So can't admit. Most of my questions come to you, but during this partnership, I've been very much, I guess, behind the scenes, doing lots of emails, doing lots of the boring businessy stuff, whilst you've been doing the clinical stuff.
Yeah.
And I guess over the past few weeks, I've been really interested in the clinical side, and I thought the questions that I had to ask you might be interesting to some other people. Yeah,
I think that's a good idea.
Yeah.
Bit of education.
Yeah, well, I also asked my wife, I've asked my family, and I've asked some of our friends to give us some questions as well. All around the topic of male aesthetics.
Yes.
You didn't know what I was going to talk about?
No, not really.
So are you comfortable talking about it?
Yes. So this is aesthetics is a big part of what I've done over the last 5 or 6 years, but trying to branch out into the male clients has been a bit different, and there's a different approach to it all, really. So
Okay.
there's a lot more kind of things to think about with male clients.
So this isn't one of my questions.
Oh, okay.
Can I have a bonus?
Yeah.
Cool. So would you say that it's easier to advertise to female clients, to get female clients on board?
I think it's a much more widely accepted thing for women to get aesthetics than it is for men.
Why?
I think there's just a big taboo around the whole subject anyway, and I think there's even more of a stigma when it comes to men.
So the reason that I'm asking why is actually, so I've had some treatment.
Yeah.
And I wasn't that bothered about it. I've told everyone.
You couldn't tell.
You can't tell now. It was a long time ago. So I've had some treatment. I wasn't bothered about talking about it. So I didn't see there being that much of a stigma around it. But then I also seen the male side of aesthetics as, I don't know. So I had something under my eyes. They looked quite dark, and although they look quite dark now,
We've got a good light going on.
my wife just had a baby boy, so they're dark. There's a reason. Before, I was just tired all the time, and I wanted to do something about it, and I did, and I felt more confident about it. I didn't come for a lip filler.
No.
I didn't come for I don't know, some injections into my forehead or anything like that.
Yeah.
Because I don't see that as male aesthetics.
No, that's it. Yeah. There's a few categories that you fully associate with women, such as lip fillers.
Fine.
But there's, like I said, there's a whole sort of different approach with men, because a lot of men don't want those lip fillers or the frozen face or all these sort of words such like trout pout, etc. It's just,
what's a trout pout?
When it comes to like fillers and you.
Oh, okay, cool.
Picture Leslie Ash. But yeah, there's a lot more different subtle approaches
Katie
that
Price.
men. Huh?
Katie Price.
No, Leslie Ash.
Yeah, but Katie Price as well.
Yeah, she probably did. Yeah,
Fine, okay, yeah.
Those sort of things. Yeah.
Like,
With men, it's not obviously something they go for, but that's what the stigma is with aesthetics. That if you're going to have any sort of treatment, it's going to give you those sort of celebrity or the mishaps that go along with aesthetics. There are lot more things that you can have done And I personally like to follow the natural sort of approach and keep things very subtle.
Cool. So that kind of brings me on to some of the questions I wanted to ask you.
Sure,
so
yeah.
I'm going to fire them at you. Yeah. And
Go.
So, well, I've given you some warning on some of them. The first one being PRP.
Yeah.
So again, for background, I don't know much about this at all. I know that we offer it, and I know that Tom's seen some clients. I know how much the clients pay. I know what email they get after. I know about their journey. I don't know what it actually is and what it actually does. Through, I guess, research for this video, I know that it's to do with hair loss. Is that or?
So
what is it?
PRP it's platelet-rich plasma. It can be used for a multitude of things, but when we're talking about men and hair loss, we're talking about it's a way of stimulating the follicles to go into their production phase to encourage sort of more follicles to grow hair. It's only used on sort of thinning hair, so if the follicles are there but they're getting a bit thinner, it's not, unfortunately, for people who have lost all of their hair.
Right.
The way it's done is you draw some blood from the client, you spin it in a centrifuge, take the nice bit that you need, and you inject it into the areas you want it.
As an example then, if a client or somebody came to you and said, I'm starting to lose my hair because of stress, I've got this bald patch, and I guess it's clearly, or an autoimmune disorder.
Yeah.
Could it be used to help that? Or is that
so
more
things
medical?
like, if we're thinking along the lines of like alopecia or stress-related baldness where you've lost all the hair and the skin is smooth, it won't help with that. But if you've got sort of baby hairs or things in the same sort of area, or it's not quite gone, then it can be used. But this is more for people who are, well, more for men and women, but where their hair is starting to thin. So when you look at the top of the crown, it might look like it's going a bit thin. We know we're all expecting it at some point.
Yeah, well, we are as men, which is a good point.
Yeah.
So if men are expecting that at some point, even if you've not got it in your... I've got a few mates who have got no hair now, and their parents have... well, your brother. Your parents have a head of full hair.
Yeah.
Is it popular? Does that mean this treatment is popular?
I think it is used a lot by certain men, but I think a lot of people don't understand it, so they're not intrigued, and it still, again, falls under that umbrella of aesthetics. Right. So people aren't... it's not as popular as it could be, but I think, again, it falls back down to the whole stigma around aesthetics, and this is an aesthetic treatment. I think it's one of those things that people aren't aware of. So people are fully aware of going to Turkey to get your hair implants and hair transplants, then that's for people who have got receding hairlines, but this is different and it's more for thinning hair, so people aren't, I don't think, aware of it. But there is a lot of people who do get it.
I guess that's because, like, hair transplants, there's lots of famous people who've done it in there.
I think hair transplants are they're like a hot topic, aren't they? So everybody's aware. You can go to places like Turkey to get Turkey hair transplants and Turkey teeth. So that's what's people's go-to when they're losing their hair, but they don't realise there are things that you might be able to have in the meantime that you can commit to hopefully help.
Okay, which is cheaper?
Yeah, I think so. Long term, it's a lot cheaper than, I don't know how much a hair transplant is, to be honest.
Well, a couple of grand, surely.
Yeah. But this is, you have to commit to a few sessions of this every sort of 6 weeks.
Right.
And the results aren't instant like you would maybe get with a transplant. Right. You normally don't see treatment, you don't see improvement until sort of 2 or 3 sessions in.
Okay. Does it work? I know we sell it as a product or as a service. Yeah. But just honestly, does it work?
So yeah, the stats out there suggest that there's a lot of men see improvement with it. So somewhere between 79 to 90% of men see some level of improvement, and that is along the lines of less hair being lost, more hair growth, and thicker sort of hair as well, within sort of 6 to 12 months. So again, it's not instant.
Fine. So follow-up question then.
Yeah.
Why haven't you done it?
Because I'm not thinning. on my hair. I just have a receding hairline, and this wouldn't work on a receding hairline. Sure. I need to go to Turkey.
Okay, cool. So that was I guess when we're talking about the taboo of male aesthetics, and when we're talking about treatments, that to me seems like something that would be quite popular, and sort of start to almost break down the walls and the barriers between aesthetics. Interestingly though, another one which I did not know that we did, because it's never been called this before, but anti-sweat. What's the proper name for it?
Hyperhidrosis,
which
basically means sweaty armpits.
Fine. Again, completely naive to what it actually does, but this stops people sweating.
Yeah.
From your armpits.
From your armpits. So you're injecting botulinum toxin, or better known as Botox, but you're injecting botulinum toxin into the sweat glands in your armpits, and this stops them from secreting sweat. Not completely, but a massive, massive improvement. This is a massive problem that obviously a lot of the population have. So this isn't just men, but this is for women as well.
Fine.
But obviously you see a lot of, statistically, men are generally sweatier. They are hairier, so they sweat more, and this is a massive help for a lot of people. I would say this is something that should be used seasonally. So it's going to last somebody about 6 to sort of 9 months.
Right.
So I would recommend having this done as we're getting hotter,
mm-hmm.
and utilising the effects throughout summer.
Yeah.
And then obviously during winter, we all don't sweat as much just because it's colder, so it's not necessarily needed. But it can be used and topped up because obviously some people sweat a lot more anyway. So yes, it can be used by anybody, but obviously in men this is a lot more sought after.
Yeah. And I guess it's probably, again, something that's not discussed very openly.
Yeah. It falls under the umbrella of, Botox. So it's something that people just assume is cosmetic and aesthetic and used for lines and wrinkles.
Okay, so anti-sweat and PRP are both things that could help men, not specifically, but for the sake of anti-sweat or the fancy name.
I mean, even thinning hair can be women, can't it, as well? But we're talking about things that are predominantly male-centred.
Cool. So I guess the big one then, you didn't know about this one, but I wanted to talk about anti-wrinkle injections.
So this is the same product we were just talking about with the sweating. This is botulinum toxin.
Yeah.
It's better known as Botox, but we call it botulinum toxin or anti-wrinkle treatments.
And do you see men wanting this?
You do see some men wanting it, but the percent of men versus women, I think it's 20% of men have botulinum toxin injections for anti-wrinkle treatments. This has gone up dramatically over the last sort of 3 years or so, where it's gone up by 120% of men having this for anti-wrinkle. So it is increasing, and we are seeing men take it on more, but predominantly still only 20% of the population that have it is still men.
Okay. So one of the things that I've seen in, I guess the way you talk about it, is this being a proactive treatment rather than reactive. Whereas I think guys as a whole, certainly me, I'm very lazy, and I'm not going to do something until I have to do it. I don't think about what I'm going to look like, as you can see, in 20 years. I just do it.
Yeah.
And I guess that's probably this type of thing. If this is first of all, what do you mean by proactive and not reactive? Does it not work straight away? What?
So the whole point of this being proactive rather than reactive is, and you see this in men, so the most likely age men get this treatment is between the ages of 40 and 55. They're the men that come after this treatment.
Yeah.
You see that I've treated men that are obviously younger than that before, but the stats of men that come for this treatment are older, and that goes with what you just said of men don't care until it's a problem or they notice they want a resolution.
Right.
That's why we don't go see the doctor until there's a big problem, and we don't go there with until we need to. But proactive means you are trying to prevent creases or lines on your forehead, in between your eyes, before they are what we call static lines. So static lines are if you look at someone's face, they're not making any expression, but you can see the lines on the forehead and in between their eyes. So don't zoom in, but between the forehead and on the lines. If they're there at rest, they're what we call static lines. So they're there, they're embedded. They're hard to get rid of, and Botox will have limited results.
Right.
If somebody doesn't have lines on their forehead and they start getting things like anti-wrinkle treatments, you are then going to be able to stop those lines from being there and being embedded, essentially, and you're going to be treating the cause before it becomes a problem.
Yeah.
And you see that in younger sort of, that it should be, or you will see younger clients coming through the door with that. Okay. I have clients that are sort of late 20s, early 30s because they are being proactive about their treatment.
Is there, well, first of all, I want to know how it works. So, again, very naive to it all.
Yeah.
I know something goes in, it's an injection.
Yeah.
And like you said, I've seen when people have got an insane amount of this injection and the faces are still and they can't smile. What happens? How does it work? Like, what's the mechanics behind it?
You have the botulinum toxin, you dilute it in some saline or bacteriostatic, whichever solution you prefer. You draw it onto some needles and you inject it into the face.
Right.
The predominant areas we inject is your forehead, in between your eyebrows, and then what we call your crow's feet around here. Sure. And when people smile or when they make faces, you can see these lines appearing. And there's methods to how we inject it and why we inject it in certain places. But essentially, you inject the solution into the muscle that is making that movement happen.
Yeah. And
that will then, the botulinum toxin will then stop the conduction of a chemical called acetylcholine,
right,
which is what contracts the muscles to make them move.
Okay.
By injecting the botulinum toxin, it stops that movement.
So you're paralysing
your muscles. Yeah, temporarily.
Fine. Okay.
So it lasts about 3 months, give or take. And there's lots of factors to why it would last longer or less.
And do you recommend that to make sure you're being proactive, you hit a certain age and you start to think about, I need to look after myself now.
Yeah.
We know that age.
Yeah, I know it well.
Feel like we're there.
Yeah.
Do you recommend that this is an ongoing treatment?
Absolutely. Yeah. This is something you need to keep on top of. As soon as you let this wear off and all the chemical has gone out your system, all the complete movement has come back into those muscles, you're basically resetting and starting again. If you keep on top of it, the muscles will stay sort of semi-paralysed and paralysed, so the movement won't come back, and you're not allowing those lines to come back in your muscles. So yeah, absolutely keep on top of it.
But is there, because that sounds like something that someone who's in a business for anti-wrinkle treatments would say. But is there, I guess, is there a time period for me if I was to do this? Because I mean, how much does it cost?
So it depends on how many areas you have, but we charge anywhere from £150 to £230.
Sure. So £230 every, let's just say maximum
3-4 months.
Every 3 or 4 months.
Yeah.
Is there a period that I can then say, right, I've done this for 10 years. I can already start to see the benefits.
Yeah.
I can kind of let go now because the anti-wrinkles worked. I've not got the creases that I would have had in those two. Right.
Yeah. So there used to be a bit of a myth buster. Maybe that's something we could talk about another time. But myth busting. People would say, well, if I've had Botox for 10 years and I stop having it, that last 10 years worth of wrinkles I should have got will all come piling on.
Yeah.
It doesn't. Right. You just kind of, you've delayed that coming on. And you just...
Why is that? Medically, what happens with the skin? Like,
so this is the skin. So by not using those muscles, the collagen in the skin remains healthy and it's not being damaged by moving the muscles. By moving the muscles, you're breaking down the collagen, so that's when you get left with lines and creases in your face. But the collagen isn't being broken down because you're not moving your muscles.
Okay, so another question.
Yeah,
I'm just very interested in this topic because it just blows my mind.
Yeah.
I'm currently on placement in the hand clinic.
Yeah.
And the one thing, because of the area where it is, and it's quite far away from the heart, blood flow, the one thing every single one of the hand fellows and the doctors and consultants are saying are do not smoke. because it reduces the healing in these areas dramatically.
Yeah.
Not to the point of don't smoke because it'll be better for you. You won't heal if you carry on smoking.
And I think that's specific to hands, isn't it?
Yes. I guess my question is, for people who do smoke, who I think there's research to say that people who smoke get more wrinkles, their skin, and is that to do with the collagen?
So it's due to many things, but collagen production, yes. But if you imagine smokers, a lot of smokers get what we call smokers' lines.
Right.
So when they pucker to smoke on a cigarette, they get a lot of creases around here. So that would definitely do it, but it slows down the production of collagen. But I think a big thing with healing and smoking is your circulation is just poorer. So when you're thinking about hands, that's your peripheral anyway. So the circulation to your fingertips is at its weakest at all your extremities. But if you're smoking as well, it's going to be worse. So people who have hand surgery, obviously the healing is going to be riskier. When we talk about healing with anti-wrinkle treatments, it's very minimal. It's not very invasive. It's a very fine needle, so the risk of any infection and things is still there, but it's very low, just because the amount of the wounds from the needle is minimal.
Interesting.
Yeah.
Okay.
But the collagen and smoking is hand in hand as well.
Good.
Very good.
Okay. So a broad overall question then: how do we this taboo male aesthetics world? How do you, as a businessman who's looking to appeal to, I guess, gents who are conscious and getting to that age where they want to start looking after themselves, especially with things like hair loss, which is huge and it's such a big. It's a confidence thing, isn't it?
It is, yeah. And there's a lot of stuff nowadays. And not in a bad way, but vanity is a massive part in what we do, isn't it? Nowadays, that your appearance and how you express yourself is very much based on how we look, how we dress, etc. So hair loss and young men, 'cause it happens to anybody, doesn't it? But young men who are losing their hair, this is something they might be able to consider and see if it helps. But the way to break through that taboo is like stuff like this.
Talking.
Yeah, talking.
Okay, so I guess you, as a businessman, who you do these treatments and you want to help men feel more confident about themselves, and that just to vouch for him, that is a very genuine thing. That's not a sales pitch. He wants to help people feel confident, and if you don't need to help to feel confident, great. How would you break down these barriers and this wall of this male aesthetic stigma?
I think what we're trying to do is essentially talk about it, get it out there to the world, make people aware that there are things that exist to help you with your confidence and things. But we like to keep things very natural, and I would use the term sort of corrective sometimes. So a lot of the people we treat, they've got like an old issue where they've got a bit of, let's say, asymmetry in their lip and they want to correct it. So we're all about the correction and the natural appearance with things. So if we can help that with natural things, it's a way of going forward. And like you said before, the PRP thing for hair loss, we're using your own blood to help. So we're not using anything chemical based. We are using what is yours to help fix a problem of yours. So I think our point is to talk about issues and break down those barriers, because there are things out there to help.
So as a recap then, I wanted to talk about the stigma behind male aesthetic. I think it's a really interesting thing. When you talked about how you wanted to be a male aesthetic specialist, I had no idea what that meant. I've had to do some research. I've had to look into all this stuff. I got no idea what it all does, which is why I thought it'd be interesting to talk about it. But even more so, I think it's really interesting that there is that stigma when it can just promote confidence and help people feel better. And I guess linking into mental health, I'm okay saying that I have suffered with some mental health things in the past. Luckily, nothing to do with my confidence and how I looked. However, had I have had some confidence issues on top of that, I might,
affect your mental health. Yeah, it does. Yeah, for sure.
So that's all the questions that I had. Thank you for answering them in this format. I know it's
Yeah.
quite strange, but I just thought it'd be interesting. And actually, that was dead interesting.
Yeah, really interesting.
The mechanics in the way some of it works is super interesting, but also how some of these treatments seem like a no-brainer to me for somebody who is potentially struggling with their confidence, with their mental health because of the confidence.
Yeah.
I mean, hair loss is a huge thing, isn't it?
Yeah, massive.
Yeah, I just think it was very interesting to hear your side of it as a clinician who does this kind of thing.
Yeah, it's nice to be able to kind of explain, because you don't always get the chance to explain how things work and the pharmacokinetics of all these procedures, or the actual step-by-step process of it. So it is nice to be able to talk about it and hopefully give you an understanding of what we're doing to help.
Yeah. And you do still treat females?
Absolutely, yeah, absolutely.
Not biased.
Yeah.
But the male aspect of it and helping...
Yeah, big push. I think it's going to be a big, make a big difference with the clients we get through the door. Yeah.
So thank you, Tom. Thank you very much.
You are welcome, anytime.
I'm sorry about some of those curveballs. Keep it interesting. And thank you guys for watching. I think if you found this interesting and you wanted to see something more, you wanted to hear from a nurse practitioner, which is very different to a doctor, but there is some borders which you crossed, didn't they? About any other topics, let us know. And I think we're going to be doing some more of these just to talk about some of the stuff that we encounter in this line of work, but also me as a student nurse, and we've talked about the crisis that the NHS is going through. All of those topics. If you want to hear about it, subscribe, like and follow.
And if you've got any specific topics you want to hear about, then please comment in the section below, and we can do some conversations with Liam about those as well.